So there's breaking news that this lawsuit that's been going on with the GLP-1 medications has been updated to include a few extra things. I will talk about that in just a few minutes, but what I really want to talk about today is this safe for you? What is the biggest issue and why is this lawsuit happening? I'm Darlene Gonzalez. I'm the nurse practitioner here at Optimum Health of Utah, Integrative Medicine. So, number one, why is this lawsuit happening? First of all, whenever there's a lawsuit, it's because they feel like there wasn't enough disclosure. Why was I not told that these side effects could be possible? That's usually the gist of having a lawsuit. But those side effects, the biggest ones that they're concerned about are gastroparesis, ileus, which is a paralysis of the intestinal tract, sometimes vision changes, blood clots, cyclic vomiting. There's a lot of different things that go into this. And that is why some people are joining this class action lawsuit. The accusation is that the lawyers are saying that these big companies that make these brand name products that have the GLP-1 hormone in it, they knew about this but didn't disclose it. So that is something that I would be upset about too. But let's talk about disclosure. Okay, so number two, disclosure. Have you been getting your medications from a provider that hasn't disclosed this? Majority of the time, I highly doubt it. But let's talk about, is this medication still safe to take? First of all, if there are issues with the product, that's a completely different story. But if you're getting a good product, a good clean product, and you have these side effects, there's always a reason for it. Some of the side effects that you have are related to malnutrition. Why do we have malnutrition when we're on semaglutide? Because we're not eating nearly as much. That could be any diet, okay? Why are these people having ileuses, paralysis of the intestinal tract? Because they're not eating or drinking. If you stop eating or drinking, I don't care what diet medication you're on, you're going to develop an ileus, which then is going to turn into a blockage. So that's another thing. Gut biome. If you have an issue with microbiome in the gut where you're not absorbing those nutrients, maybe you're not taking in the proper nutrients. So that goes back to, are you taking in enough greens? I'm talking not kale and spinach, but mainly you're going to want a scoop of greens that has everything, all your A, B, C, D, B vitamins, B1, 2, 3, 4, 5, 6, your superfood greens, your probiotics, your gastric enzymes. You want all of that to keep your body healthy and full of nutrition. We have this one here called Primal Greens. There's also another one called Athletic Greens that are absolutely amazing. You have to use something like this in your daily routine when you're on semaglutide, when you're on GLP-1s, when you're on a GIP, because your body's not taking in as much nutrients. It is common sense. Do not expect your body to be fully nutritioned if you're not adding your nutrients, okay? So that is super important. Why do people have issues with dehydration? Because they're not drinking enough water. Okay. This is number three. We want to break down some more of those major side effects that we talked about originally. We talked about ileus and gastroparesis. Well, when your intestinal tract slows down and stops, it's just basically because there's nothing moving in it. If you stop moving your gut's going to stop. Constipation and bowel obstruction, those are related usually to your reduction of gastric emptying. And then in return, you're also not taking in as much water. So both of those added together causes constipation, which then can cause a problem with that bowel obstruction. I have never seen it in my practice, but I have heard about it. So I tout 3 liters of water every single day. If you're not drinking that much, I don't want you on semaglutide because it kind of acts like a diuretic when you're pulling the water, the food into the gut to absorb in the lower intestinal tract with the GLP-1. You're also pulling the water. So think about it. You're basically diuresing. So you've got to add that water. Okay. There are a few things that we can add to your repertoire on a daily basis, and Digestizyme will help that. It'll increase those digestive enzymes and help with that bowel movement. And then your orthobiotics, so your probiotics, okay? Think about that. Think about the things that you could do to help prevent these issues but I like to see my patients on a weekly basis to prevent these issues to begin with. So if you have someone that's giving you the medication and you're not seeing them often, I would reconsider. Okay. There's another side effect that a lot of people have been having, and that's hair loss. Why do you have hair loss when you're on a diet? Because you're taking in less nutrients. That goes back to this. You have to have your nutrients in a low calorie form. So, of course, you want to lose weight. So, you don't want to add the nutrients back with food. You want to do it in a micronutrient like this. Okay. So, that's going to help prevent hair loss because hair loss is huge if you're malnutritioned. Gallbladder issues. Why do we have gallbladder issues on this? Well, why do we have gallbladder issues with any diet? It's because originally, when you were overweight, you had developed gallstones, but as long as you're putting in all that food and that grease and that oil and that fat, it's going to continue pumping out. Well, if you stop that and you lose a lot of weight, sometimes you can cause a blockage in that little door that goes into the gallbladder. Okay, and that actually can cause an issue with a blockage with the gallbladder, and then which requires surgery. So if that happens, it's not the end of the world. We can live without our gallbladder. But if you don't want that to happen, don't go on any diet. Okay, because or just reduce your fat content. And then last, there's some vision loss and clotting issues that have been brought up recently on this lawsuit. I've never seen it, not once. They're still under investigation, even with the lawsuit, because it's so extremely rare, but it's worth monitoring and making sure that there's no issue. I, in my mind, believe that the blood clots has to be related to more of the dehydration. So make sure you're drinking your 3 liters of water. Okay, so number 4, is it the drug or is it the way that it's been being prescribed? So a lot of times a GLP-1 works by decreasing the gastric emptying. This is why it's so effective because that stomach stays super full and small at all times. But they're touting and stating that the problem is aggressive box label dosing. And then that box label dosing states start at 0.25 milligrams and then go to 0.5 in the second month, which is doubling that dose. I do believe that that might be part of the problem because we immediately figured this out 3 years ago when we first did this at our clinic. We don't do that. We incrementally increase super slow before we get to that 0.5. And that's how you prevent this severe cyclic vomiting, nausea, and acid reflux. Honestly, when you look at the nutrient dense foods, the hydration, and all the other supplements that you can do, you're going to prevent any of these issues. I'm going to remind everybody that is watching, we've never had these issues. So I don't have to worry about that necessarily in my practice because I see most of my patients at least for the first month on a weekly basis. Okay, so those severe complications are extremely rare, but I want you to also realize that there is something that we can do to reduce these risks. And that is making sure that you add in those good foods, whether it be this way, because you're not doing nearly as much as you used to. So the foods that you take into your body have to be nutrient dense. Okay, so number 5 is what have we seen in our practice? We have had thousands of patients that we've worked with the GLP-1, and here's what we've seen. I think the most common is we'll see hair loss, and those are usually the people who cannot handle this right here. There is another one called JUCE that tastes like fruit juice. If you take your nutrients and you use that, you're going to prevent that hair loss. And then one patient did develop gallbladder issues. Those gallbladder issues are obviously gone because she had her gallbladder removed. And we do believe that that was something that she had originally with previous diet that she was on. And that diet that she was on was the keto diet. And they actually were going to take it out then, but she moved to this, felt fine, and then ended up with this gallbladder issue. So it's very rare here. And then, like I was saying on the last segment, that severe complications are severely rare if you pair this medication with nutrients, water, protein, okay, and exercise. You cannot forget the exercise. You got to be moving. Okay, so number 6 is how do you reduce all these risks? So I know this is kind of like is going to take everything and consolidate it. You want to stay on your lowest effective dose. You don't want to go up if you're not needing it, if you're losing weight effectively. Monitor your blood work before, during, and after your treatment. It's not mandatory, but it's very important. Because what if there is an issue? And what if we can actually see the cholesterol continuously going down, et cetera? It's awesome to see that. Support your body with all these nutrient dense foods. We do have this particular food here. It's called 1% Fitness, and they're GLP-1 foods that they make specifically for you. And if you go through us, you will get 25% off your first month's order or your first order. And then after that, you get 10% off. So hydration, nutrient dense foods, health protocols, water, protein, and exercise. Work with your provider. Make sure that they track not just your labs, but your symptoms, energy, digestion, mood, all of that stuff. Because if you are actually feeling worse when you're on this, there's a problem. We know that you're probably nutrient deficient. So we're going to talk to you and tell you, hey, this is something that needs to be done. If you don't do it, we might consider not re-upping your prescription. So think about that. It's super important. And we don't want to be one of those people that are added into this lawsuit. You want to be healthy while you're on this. You want to lose weight and stay effective with your weight loss and actually keep your weight off. Okay, in closing, I just want to reassure you that being on any of these medications, Ozempic, Wegovy, Mounjaro, Zepbound, any of those, that includes compounded GLP-1s and GIPs, you can do this safely. These medications can be safe and effective with proper health. If you don't have any issues with this, then you can continue on it literally forever because it really does help with the metabolic disorders. I'm Darlene Gonzalez with Optimum Health of Utah, and if you have any questions, give us a call, 801-756-1404.